Good afternoon. I'm Dr. DeShawn Taylor. I am the founder and CEO and primary provider at Desert Star Family Planning in Phoenix, Arizona. Welcome to Well Woman Wednesdays. I come on every second and fourth Wednesday of the month to talk about a women's health topic. And so today that topic is, how do IUDs work? And so I'll just give a moment for the notifications to go out that we're live. Welcome. Thanks for joining me today. And so, again, I'm Dr. DeShawn Taylor. I am a board-certified gynecology and family planning specialist. I am the founder and CEO and primary provider at Desert Star Family Planning in Phoenix, Arizona, which provides abortion care, general gynecology care, and gender-affirming care for the families of Arizona. And so this topic is near and dear to my heart, as I like to think of the intrauterine device, IUD for short, as forgettable birth control. It's there, it's working for you. You don't have to think about it until you either want it removed because you are ready to become pregnant, or you are having it removed because it's time to get another one because you don't want to be pregnant. But it is just a really excellent form of birth control. And I know that people have a lot of questions about it. And so I want to take a moment to go over that today. So we think of intrauterine devices in two ways, hormonal and non-hormonal. And these are T-shaped devices that are placed into the uterus through the vagina, through the cervix, into the uterus by a trained healthcare professional. And these T-shaped devices have a little string from the tail, and that string comes out through the cervix. And so when you're having a pelvic exam, your healthcare provider can see those strings and know that you have an intrauterine device in place. And the string helps us grasp onto the device when it's time to remove it. And so there are several different types of the hormonal IUD. There is the Mirena, there is the Liletta, there is the Skyla, there's the Kyrena. What they have in common is they have the same hormone in them, but varying distributions of the hormone that is passed into your system daily to prevent pregnancy. And so the key with this one, though, is that its mechanism of action. Now, the mechanism of action of the hormone-releasing IUD is it makes the mucus of the cervix really thick. And why is that important? Well, first of all, we have cervical mucus that changes throughout our cycle, which during the time that we are fertile actually gets more wetter and waterier, slicker, and it helps facilitate the sperm through the cervix into the uterus so that it can meet up with the egg to fertilize it when you ovulate. And so when this device makes that mucus really thick, it literally forms a barrier, a wall, where the sperm cannot get into the cervix to enter into the uterus, to swim up to the tube, to hang out for up to 5 days, to wait for the egg to drop, to fertilize it, to start the process of pregnancy. The other important thing that this intrauterine device does is it really thins out the wall of the uterus. And so what's important about that is as we cycle normally, the lining of the uterus builds up to prepare a welcoming environment for a pregnancy to implant and grow. And so if there's not a nice, fluffy, welcoming lining, then the pregnancy can just pass through. And so those are the two main mechanisms of action of this IUD. Also, when the egg and sperm meet, there is a certain timeline of activities that happen in a certain amount of time that this needs to happen in by the time the what we call blastocyst is the stage that it's at by the time it drops down into the uterus, ready to implant. And so there's specific timing of this. And so the hormones actually slow down the motility of the fertilized ovum and all the cellular content known as the blastocyst. So if the timing's not quite right, that kind of throws things off too. So this does not stop you from ovulating. And so if you are still cycling, so you can have PMS symptoms, you can have mood changes, you can have all those types of things that happen when you are having your natural cycle. So I always warn patients that you could still have PMS because you're ovulating, but the mechanism of action of this IUD is so effective that really doesn't matter. The pregnancy is prevented just as good as sterilization, except not permanent and not surgery. And so another nice kind of byproduct of the lining being thinned out is that people are guaranteed a lighter period. And then there's a percentage of people who don't have a period at all with this IUD in place. And that is absolutely okay to not have a period with this IUD in place. So then it is also a treatment for heavy, painful periods, as well as birth control. So that's what's nice about this hormone releasing IUD. And so then the other type of IUD is the non-hormonal IUD, which has copper in it. And so what is marketed here in the United States is called the Paragard. And so the way that this IUD works is that the copper that is on the device is toxic to the sperm. And so it impacts the ability of the sperm to be able to swim and to actually have the reaction that takes place when the sperm meets the egg to actually fertilize it. The other thing that it does is it creates this hostile environment in the uterus that does not allow a pregnancy to implant and grow. It also changes the motility of the tubes as well, which again impacts the function of the whole fertilization process. And so this is a very, very effective method of birth control. And this particular IUD, the Paragard, can also be used for emergency contraception. If it's inserted within 5 days of unprotected vaginal intercourse, then it can actually prevent pregnancy and then stay in place for ongoing pregnancy protection. And so with this IUD, again, it's not inhibiting ovulation, so you're having your cycle. And then the case that's different from the hormone releasing IUD, a person is going to have a full flow for their period. With this IUD in place, it is possible to have a bit more cramping with the period, a heavier flow, and a longer flow. And so this is not an IUD that I recommend for people who already have heavy, painful periods. However, if you have a fairly light period, only lasts for 3 days or so, this is definitely a really good option, especially in people who are concerned about having any types of hormones in their bodies and or have any what we call in medicine contraindications, meaning reasons that you should not have any hormones for your contraception. And so kind of taking a step back here, how long do these devices work? And so because there were a few different types of the hormone releasing IUD on the market, that varies from 3 to 7 years. Now, these devices are FDA approved to work for 3, 5, and 6 years. The two devices that work the longest, that function the longest to prevent pregnancy, are the Mirena and the Liletta. They are both pretty much the same device, but just made by different manufacturers. And we know by research that these devices are actually preventing pregnancy out 7 years. And so although the FDA approval says less, as practitioners, we are telling our patients that those devices are, they're able to keep those for 7 years. And then with the copper IUD, the Paragard, it is FDA approved to provide contraception for 10 years, and research has shown us that it works for 12. And so practically, we're telling patients that they can keep that IUD in place for 12 years. Now, these are very long-acting, reversible contraceptive methods. And because they work that long doesn't mean you have to keep them that long. They are really good choices if you are wanting to avoid pregnancy, at least for a year. And they are easily inserted by someone who is trained to do so and easily removed by someone who's trained to do so. And so some questions that people have that I want to address right now is, what is it like to have one inserted? And does it hurt? And so the short answer is there is some discomfort associated with the IUD being inserted. And I always tell my patients that it's a moment of slight discomfort for years of forgettable birth control. And so when you are getting an intrauterine device inserted, you are in position on an examination table with your feet in something called stirrups. That puts you into a position where your provider will be able to visualize your external vulvar and vaginal area, and an instrument called a speculum is placed, which allows us to open up the vagina so that we can actually see the cervix. And then the cervix is grasped with an instrument that allows us to kind of straighten out the cervical canal, because the uterus is hanging, normally kind of suspended in the pelvis by ligaments. And so, and it flaps kind of forward or backwards. And so we want a straight entrance from the external opening of the cervix to the internal cervix that opens into the uterus. And so we put a little instrument on there to just give a gentle tug to straighten that out, so that the IUD goes directly through the external cervical canal entrance to the internal and into the uterus, and in its proper location in the uterus. And then there was an inserter that helps us do that. And then the inserter is removed, and then there's the string that hangs from the cervix, not from the vagina like a tampon. And we trim the strings, and generally the strings kind of soften up over time, and then they kind of fold under the cervix. And so initially, when the IUD is passing through the external to the internal cervix opening, that is the part that can be a pretty intense cramping. And so different providers have different techniques that they do to help minimize that discomfort for that part of the insertion. But generally, by the time you feel that, the IUD is in position, and it's just a matter of trimming the strings and we're done. Initially, afterwards, you'll have some cramping and mild bleeding for about 3 to 4 days, and maybe a week. And then your body, you can have some cramping and spotting as your body's getting used to the IUD being in place. And so I tell people to give that a good 2 months or so. Then people generally feel much better after that. And then you have your long-term birth control potentially for years. I do tell people, though, if they're finding that it's very bothersome those first couple of months, and of course, if you want the IUD removed, it should be removed. Like, no one should insert something into your body and then give you a hard time removing it. So you want to just know, though, that if you can get through those first couple of months, most people feel absolutely fine and they're good to go for the next several years, that they're going to have the IUD in place. There are two things that we are concerned about at the time that we're inserting the IUD that we want to check on. One is that there can be an infection at the time that the IUD is inserted. That is not common at all. It's so uncommon that we don't even provide prophylactic antibiotics prior to inserting the IUD. However, it is something that we look out for. So we ask people to avoid sexual activity for a few days initially when the IUD is inserted to minimize the risk of pushing bacteria up through the cervix into the uterus while the cervix is still open from the insertion. And the other part of it is that it does take 7 days for the IUD, the hormone-releasing IUD, to be effective as your birth control. So you want to either abstain or use condoms for that first week. And again, the copper IUD can be used for emergency contraception, so it becomes effective once it's inserted. The other thing that we are concerned about at the time of the insertion is something called perforation, meaning that we're poking a hole into an organ. And so that is not something that commonly occurs, but it is possible that the IUD can be inserted through the uterus and end up outside of the uterus, or in the muscle of the uterus and eventually outside of the uterus. And so again, when someone's well trained with these, that risk of that happening is extremely small. Then in terms of once the IUD is inserted, a concern is that the IUD could partially come down out of position or completely out of the uterus and cervix. And so I personally like to see my patients back in about 6 to 8 weeks to do an examination to evaluate for infection and to check the position of the IUD for those things. And but there are some providers who don't routinely do those follow-ups, and they ask that patients call them if they have any concerns. So how would you know if your IUD is coming out of position? Well, one of the things is, I mentioned that, yes, you're going to have some cramping and a little bit of spotting, but really, it really shouldn't be painful. Like, you really shouldn't be like, oh my God, I'm having so much pain. Because when the IUD is in its proper location in the uterus, it's generally not painful. The reason that people feel a lot of pain when the IUD is out of position is because the cervix is very sensitive. And so when that IUD is down out of position and it's actually sitting in the cervix, that is painful. It's actually slightly dilating the canal of the cervix because it's sitting there when the cervix is usually closed, and that's what's causing the pain. There's also bleeding out of proportion that then would be expected. We don't routinely ask people to check their strings of the IUD anymore, but that used to also be a way that people could determine that their IUD is out of position because they're checking their strings, and the strings are now closer to the entrance to the vagina than they had been initially. One of the reasons that I don't routinely tell patients to check strings is because once the strings soften and they fold up underneath the cervix, people can't feel them anymore. So then they think that it's fallen out. So now they're stressed out because they think their IUD has fallen out, and it's just that the strings are out of the way. And the vagina for some people can be fairly long, several inches, and so you just can't reach it. And so that's why I don't personally tell people to routinely check the strings, because it causes a bit more anxiety than is necessary. And so when it is time for the IUD to be removed, we grasp the strings that are coming out of the cervix with the instrument to give a gentle tug, and it generally just comes out. Now, there are some instances where the IUD is difficult to remove, and this has happened, and a couple of things have happened. One is, if the strings are trimmed too short, then sometimes the strings will kind of roll up into the cervix. And so when your provider is examining you to try to remove it, then they don't see the strings to grasp. And so then that would require someone with experience and training to actually use some type of instrument to actually go into the cervix, go into the uterus, and to actually remove the IUD. The other thing that can happen is sometimes the IUD becomes embedded into the wall of the uterus. And so when that happens, it can be difficult to remove and may sometimes require surgical intervention to remove it. Now, these are not very common, but we hear about these things a lot because it's just the way that society works, right? We hear more about the problems and the things that have gone wrong, but we don't hear enough about people who are having good experiences with their birth control and that everything's gone fine. So, but of course, when we're talking about these things, we do want people to be aware of them. And so, again, we have the two types of IUDs, hormonal and non-hormonal. They provide birth control for anywhere from 7 to 12 years. They are just as effective as sterilization, except not permanent and not surgery. And what's really great about this forgettable birth control is that it's there, it's working for you, and you can just go on about your life and not worry about your birth control. To end here, I do want to put it in perspective with other methods. And so when you're thinking about your birth control, and you have to think about your birth control every time you have sex, there are going to be more opportunities for you to either not use birth control or to have some type of error with your birth control, right? And so then you move up to a tier to where at least you're uncoupling your birth control from sexual activity. So then at that point, you have your options of the birth control pills, the birth control patch, the birth control ring, where you're taking these things regularly, and you're not having to think about your birth control every time you have sex. But then there is some chance for user error, because you're having to remember to either take a pill daily, put your patch on weekly, place your ring monthly, on time, remove it on time. Then you have the Depo-Provera shot, where you get come into a healthcare provider and you get the shot every 3 months. And there are some people who are comfortable picking it up from the pharmacy and administering it to themselves. And so then that is less times that you have to think about your birth control, but you do have to remember to go and get your shot, or go to the pharmacy, pick up your medication, and give yourself the shot on time. And so then you get to your intrauterine devices and your implants, where they are inserted by a trained provider. They're there. You don't have to think about it until it's time for it to be removed. Now, no birth control method is 100%, not even sterilization. So all you can do if you are sexually active is make your best effort with your birth control that you feel is the best for you and fits your lifestyle. I hope this was helpful to you. Please share. We're live on Instagram, Facebook, and YouTube. Definitely share, like our pages, follow us. You'll get notifications when I go live. And thank you guys very much for your time. And we'll see you in a couple of weeks. Have a great rest of your day and week.